And reaction today from local fertility doctors after the president signed an executive order which is aimed at reducing the costs of IVF. Here's News 12 Connecticut's Marissa Alter.
People are talking about it, asking about it.
In vitro fertilization is understandably a common topic at Park Avenue Fertility. But medical director Dr. Andrew Levi says conversations have increased since President Trump's executive order aimed at expanding access to IVF and reducing its costs.
It's early in the game, but I think it's an outstanding first step for sure.
The order calls for the president's domestic policy assistant to make recommendations by mid-May to reduce out-of-pocket and health plan costs for IVF.
That cost can be over $15,000 per attempt, sometimes up to $25,000, depending on what they need. So it's a cost that's often insurmountable for some young couples trying to have a child.
Dr. Hugh Taylor of Yale New Haven Hospital says 15% of couples in the country will have a problem with fertility, and insurance often doesn't cover it.
No one asks to be infertile. This is a disease. It needs to be treated like any other disease, and people need to have insurance companies step up and pay for it. Connecticut's actually a state that has an insurance mandate, so we're better off than most. But even that, there are multiple gaps. There are many people who are not covered by the mandate.
Even with coverage, the costs can add up, something local doctors hope the administration can address.
Some people have copays and deductibles and the like, so this would also help with that, because people struggle with that as well. So I think there's multiple facets to this, which would be helpful to our patients.
I would really love to see everybody who wants a family being able to have a family.
Marissa Alter, News 12, Connecticut.